Do you know anyone who's going to die? Every 1.8 seconds, someone dies in this world. There are three main things I will be discussing about the company Home Hospice. I will start by telling you about Home Hospice itself. Then I will be telling you about Hospice House. And finally, I will be telling you about other services that the company offers. I will begin by telling you about Home Hospice. Home Hospice was started in 1995 by Hilton Chancellor, who is a minister. They serve 19 counties in West Texas with offices in Odessa, Midland, Andrews, and Big Springs. They have a full-time medical director. His name is Dr. Don McClary, who makes house calls, which is very rare these days. He is followed by nurse practitioners, RNs, LVNs, and CNAs. Now I will be telling you about the admission criteria. The patient has to be diagnosed with a life-limiting illness with 6 months or less to live if the disease follows its normal progression. Medicare and Medicaid hospice approved diagnoses include cancer, heart disease, ALS, liver disease, dementia, COPD, CVAs, renal disease, HIV, and AIDS. Efforts to cure have ceased once someone goes on hospice services. They do require one 24-hour caregiver once the patient is no longer able to take care of themselves. The physician consents to service by giving a physician order. The family then elects to participate under hospice and go with comfort measures only. The patient has to reside in the service area. Lastly, I will be telling you about their mission. Home Hospice believes that people are best served if they retain freedom and dignity at life's end. They seek to relieve pain and ease suffering in the physical, mental, social, and spiritual worlds of the patient and families by providing the highest level of care possible. They want the patients to live their life as fully as possible until death and the family to continue living afterwards. They provide competent, compassionate, comprehensive care, concentrating on comfort measures, not cure. It is an honor and privilege to them to serve these families and these patients as they walk through the valley of the shadow of death. Now I will be telling you about Hospice House. I will begin with the history of Hospice House. In 2000, the building was purchased and opened as the only freestanding in-house hospice unit in West Texas. The building was built in the 1920s. It was started out as Millie Van Horn Boarding House, later to become a bed and breakfast here in Odessa. At the time that the building was purchased by Home Hospice, it was in the process of being condemned by the city of Odessa. After the home was restored, it became a historical marker here in Odessa. Now I will be telling you about the facility. They provide end-of-life care to hospice patients of the Permian Basin. They have 9 adult hospice beds and 1 pediatric bed. They provide symptom management such as nausea, vomiting, diarrhea, pain, terminal congestion, shortness of breath, agitation that cannot be managed adequately in a home setting. Lastly, I will be telling you about donations. All monetary donations to Home Hospice and Hospice House are given to Hospice House Foundation. The house itself is run as a non-profit foundation. Lastly, I will be telling you about the other services they offer. They offer chaplain social workers. Every patient is assigned a chaplain and a social worker. Some people do not want these services initially, but a lot of them change their mind as death nears. They start exploring spiritual guidance or needing some legal paperwork help. They offer bereavement. Home hospice offers multiple options to support grief recovery. There's a grief share that is a faith-based support group. Walking with You is a monthly group. Honoring Our Memories is a grief recovery workshop that also includes counseling if needed. And lastly, Life After Loss is a weekly grief and bereavement workshop that's sponsored by the American Cancer Society. All of these services are offered at no cost to the families. They also offer volunteer services. The volunteers are required to complete an extensive 18-hour training called My Give Myself. Volunteers range from educators to retired or even existing working professionals, down to school-age children earning junior volunteer hours. Home Hospice also does an annual butterfly release in memory of their patients that have passed during the last year. In conclusion, I told you 3 different things about home hospice. I started by telling you about home hospice itself. Then I told you about hospice house. Lastly, I told you about the other services that they offer. We all know someone who is going to die. So the question is, do you want to die with or without hospice services? Thank you.